Falls in old age can have devastating consequences. Falls are frequent in old age. Why do old people fall? Old people can fall because of multiple reasons. Vertigo syndromes are one cause. Vertigo can be either peripheral, which is affecting the vestibular system, or it can be central, where the brain connections of the vestibular system are affected. So it can be vestibular, it can be because of cerebellar problems with failure of coordination, or it can be a brainstem lesion like a Wallenberg syndrome, which occurs because of posterior inferior cerebellar artery blocks. Falls can occur because of gait problems that is related to the brain. Normal pressure hydrocephalus can result in apraxia. The stretch of corticospinal fibers over the large lateral ventricles can result in gait difficulties. Parkinson's disease, dopaminergic deprivation, can result in difficulty in walking. There is gait disturbance. Gait problems can also be related to the spine. Myelopathy syndromes can occur. Cervical spondylotic myelopathy is the commonest, occurs in a setting of cervical spondylosis where the spinal cord is partially compressed. Both motor fibers and also the proprioceptive fibers, the dorsal columns, are affected, and both contribute to gait disturbance. Tumors in the spinal cord can result in spinal cord compromise. These include both intradural extramedullary tumors like neurofibromas and meningiomas, and also intramedullary lesions like astrocytomas and ependymomas. People can fall because of radiculopathies. A disc which presses upon the L5 root can produce a foot drop, or a person with S1 radiculopathy can have a waddle gait who might tend to fall especially when they are climbing down steps. It is important to remember that old people who fall might have fallen because of a secondary cause. Strokes can result in falls. Bleeds can result in falls. A seizure might result in a fall. Cardiac causes, where there is a sudden deprivation of oxygen supply to the brain, like cardiac arrhythmias, postural hypotension, or even vasovagal attacks, may result in falls in the elderly. So, to understand gait imbalance, it is important to understand that firstly, there might be a failure of power, that is, weakness of muscles may result in a stumble and a fall. There can be a failure of coordination. For example, a cerebellar metastasis may result in a fall. There can be abnormalities of muscle tone, like in myelopathy syndromes. The cervical spinal cord or even the dorsal spinal cord may be pressed. Normal pressure hydrocephalus may also result in a change in the tone. Movement disorders, because of dopamine deprivation in the basal ganglia, may result in gait difficulties. Sensory factors can affect gait. Visual acuity is important for gait because you have to see and assess as to where the next step should be. Binocular vision is important because it helps in gauging distances. Diplopia of any cause, especially, for example, a superior oblique weakness, may result in difficulty and potential falls when you are climbing down steps. Proprioceptive disturbances are a very poorly understood cause of falls in elderly. More falls are because of proprioceptive failure than because of motor failure. Proprioception involves feedback from the limbs as to how much weight is being borne in which particular part of the foot. And this results in automatic corrections. Failures of proprioception are probably the commonest cause of falls in the elderly. So, how do we manage gait imbalance? Vision augments stability of gait because you get visual feedback. So, having night lights on in an old person's room will help him or her to navigate to the toilet. Handrails on stairways, skid proof mats on the floor. These are all additional aids. People who have weakness will benefit from walkers because some of the weight can be borne by the walker. Walking sticks are actually more proprioceptive aids rather than support aids. It provides an additional proprioceptive feedback through the upper limb so that the person gets a feedback as to how his weight is being borne by the legs. Pharmacological treatment is there for Parkinson's disease and also for neuropathies. And surgical treatment for gait disturbances include shunts for normal pressure hydrocephalus and surgery for cervical myelopathy. So, a quick overview of causes and prevention of falls in the elderly. Exclude secondary causes. Did the patient have a stroke and fall? Or was there a seizure resulting in a fall? Manage vestibular syndromes. Peripheral vestibular syndromes can be managed by vestibular stabilizing drugs like beta-histine. Central vestibular syndromes are often ischemic and may require evaluation for posterior circulation strokes or even for aneurysms. Motor system weakness can result in falls. Coordination disturbances might indicate that there is a cerebellar disorder or a cerebellar lesion. Movement disorders like Parkinson's merit pharmacological treatment. Visual disturbance include a failure of acuity of vision, which might occur with cataracts, with retinopathy and glaucoma, and a failure of binocular vision, where depth and distance cannot be assessed, can be a cause of gait instability. Very important is proprioceptive failure. Posterior columns dysfunction. Why do they malfunction? It can be because of compression in a spondylotic myelopathy, especially by buckled ligamentum flavum posteriorly. Degenerations of the posterior column may also occur with age and may benefit from some vitamin supplementation. Prevention include aids like walkers, sticks, anti-skid mats, and handrails in old people's rooms. Medications, for example, dopamine. Surgery may include shunts for normal pressure hydrocephalus, and in the case of cervical myelopathy, spinal decompressions to allow the spinal cord to breathe may help.